In old age, when you wake up, notice these 5 signs and see a doctor immediately to avoid cancer. Waking up each morning should be a moment of peace, a chance to greet the new day with hope and vitality. But for those in their golden years, the body can sometimes reveal subtle warnings that are easy to dismiss. What if those seemingly minor discomforts, fatigue, a persistent headache, or unusual joint pain, were trying to tell you something far more urgent? For older adults, these signs could be more than just aging. They might be the early whispers of cancer. Recognizing these signals as soon as they appear can make all the difference. Early detection isn't just a medical term, it's a lifesaver. With cancer being one of the leading causes of death, particularly in older populations, knowing when to seek help can be the key to preserving your health and your future. In this video, we'll delve into 5 crucial signs you should never ignore upon waking. These insights aren't just about awareness. They're about empowering you to take control of your well-being. If you find value in learning how to protect yourself and your loved ones, consider subscribing to our channel. Together, we can spread the knowledge that could save lives. Stay tuned. Your health might depend on it. Waking up tired is something most people experience occasionally, especially after a restless night. But when that morning fatigue lingers day after day, it becomes more than just an inconvenience. It's a sign your body might be trying to tell you something. For older adults, this unexplained exhaustion upon waking can signal deeper health concerns, some of which could be life-threatening. Morning fatigue isn't always about a bad night's sleep. For instance, many older adults might chalk up their weariness to age, but the reality is far more complex. Conditions like hypothyroidism, where the thyroid gland produces insufficient hormones, are common among seniors. These hormones regulate energy and metabolism, so when levels drop, the body struggles to function efficiently. Imagine starting your day feeling as though you've run a marathon before even getting out of bed. That's what unaddressed thyroid issues can feel like. Diabetes is another silent contributor to this kind of exhaustion. Unstable blood sugar levels, which often go unnoticed, can leave you feeling drained, confused, and unfocused. High or low glucose levels rob your cells of the energy they need, and the result is a persistent fatigue that no amount of rest can fix. For many seniors, fatigue is their body's way of signaling that their blood sugar regulation needs attention. Left unchecked, this imbalance can lead to complications far beyond tired mornings. And then there's the possibility no one likes to consider: fatigue as an early sign of cancer. Certain cancers, such as leukemia or lung cancer, can manifest in vague symptoms like chronic tiredness, long before more obvious signs appear. For example, John, a 68-year-old retiree from Ohio, found himself waking up each day feeling as though a heavy weight was pressing down on him. At first, he dismissed it as part of getting older. But when his fatigue was paired with slight memory lapses and persistent muscle weakness, he sought medical advice. Blood tests revealed anemia caused by undiagnosed leukemia. Early detection saved his life. While these scenarios may sound alarming, they serve as a reminder of how important it is to listen to your body. Fatigue is not always a sign of something serious, but it should never be ignored when it becomes a regular part of your mornings. Temporary lifestyle adjustments can sometimes provide relief and even clue you into whether your fatigue is situational or a symptom of something deeper. Start with your hydration. Many seniors unknowingly wake up dehydrated, which exacerbates tiredness. Drinking a glass of warm water with lemon each morning not only helps rehydrate your body, but also boosts your metabolism and energy levels. Another powerful tool is movement. Gentle stretching or a short walk around your home can increase circulation, reduce stiffness, and awaken your muscles and mind. These small changes may help, but if your fatigue persists despite lifestyle improvements, it's crucial to consult a healthcare provider. Stress and mental health also play a significant role in how you feel upon waking. Chronic stress or untreated depression can lead to poor sleep quality, even if you're logging 8 hours a night. High cortisol levels, the body's stress hormone, can disrupt your natural sleep cycles, leaving you in a constant state of unrest. Addressing stress through relaxation techniques, mindfulness, or even counseling can make a world of difference in improving your energy levels. In the end, morning fatigue is a puzzle worth solving. It's easy to dismiss tiredness as a minor inconvenience or a natural part of aging, but doing so could mean missing an early warning sign of a more serious condition. When John took his symptoms seriously, he didn't just reclaim his mornings, he reclaimed his life. The same can be true for you. Your mornings are precious and they set the tone for the rest of your day. Don't let unexplained fatigue rob you of that time. Pay attention, take action, and remember, your body speaks in whispers long before it shouts. Listening to those whispers could be the first step in protecting your health and your future. Morning headaches can feel like a cruel way to start the day, turning what should be a moment of renewal into one of discomfort and fatigue. For older adults, these headaches can be more than a minor nuisance. They might be the first signal of underlying health issues that demand attention. While occasional headaches are common, persistent or severe headaches that occur regularly upon waking are cause for concern. They might be connected to conditions such as cerebrovascular disease, cervical spondylosis, or in some cases, even the early stages of cancer. Headaches caused by cerebrovascular disease are particularly alarming. This condition affects blood flow to the brain, often resulting from plaque buildup in arteries or blood clots. When the brain doesn't receive enough oxygen, the result is a pounding headache, especially after lying down all night. Imagine waking up day after day with a dull yet relentless ache, accompanied by fatigue and difficulty focusing. For individuals over 65, these symptoms might not just be about aging, they could be an early sign of an impending stroke. Cerebrovascular disease progresses quietly, and morning headaches are often among the first signs that something isn't right. Similarly, cervical spondylosis, a degenerative condition affecting the neck's vertebrae and discs, can cause chronic morning headaches. This condition, common in seniors, results from years of wear and tear on the neck. As the bones and cartilage deteriorate, they compress nerves and restrict blood flow to the brain. The result? A headache that feels like it's radiating from the back of the skull to the temples. Jane, a 72-year-old grandmother from Florida, experienced this firsthand. For months, she endured headaches that she attributed to sleeping wrong. When her symptoms worsened to include dizziness and balance issues, she sought medical advice. Imaging tests revealed advanced cervical spondylosis, which, left untreated, could have led to nerve damage and permanent mobility issues. But what about the connection between morning headaches and cancer? Though less common, certain cancers can present with headaches as an early symptom. Brain tumours, for example, often exert pressure on surrounding tissues, causing persistent headaches that worsen upon waking. This occurs because lying down increases intracranial pressure, which amplifies the discomfort. While brain cancer is relatively rare, its symptoms often overlap with more common conditions, making it easy to dismiss these signs until the disease has progressed. For seniors, this overlap is both a blessing and a curse. On one hand, Conditions like cerebrovascular disease or cervical spondylosis are more likely to be the cause of morning headaches than cancer. On the other hand, the possibility of cancer shouldn't be ruled out, particularly if headaches are accompanied by other symptoms such as nausea, vomiting, or unexplained weight loss. The stakes are high, and catching these issues early can make all the difference in outcomes. If you or a loved one frequently experience morning headaches, the first step is to take note of the pattern. Are the headaches dull or sharp? Do they occur every morning or only occasionally? Are they accompanied by other symptoms like blurred vision, dizziness, or fatigue? These details can provide crucial clues for a healthcare provider to pinpoint the underlying cause. Diagnostic tests such as MRIs, CT scans, or blood work might be recommended to rule out serious conditions. While seeking medical attention is essential, there are also practical steps you can take at home to manage morning headaches. Hydration, for instance, plays a significant role. Dehydration, especially overnight, can contribute to headaches. Starting your morning with a glass of water can help alleviate this. Gentle stretches or neck exercises can also relieve tension and improve blood flow to the brain, reducing the severity of headaches caused by conditions like cervical spondylosis. For those dealing with cerebrovascular-related headaches, adopting heart-healthy habits is crucial. A diet rich in fruits, vegetables, and lean proteins can improve overall vascular health, while regular exercise can enhance circulation. Stress management techniques, such as deep breathing or meditation, can also reduce the frequency and intensity of headaches. However, these steps should not replace professional medical advice. Persistent morning headaches are not something to ignore. They are your body's way of signaling that something isn't right. Whether it's a vascular issue, a degenerative condition, or a more serious concern like cancer, early detection and treatment can significantly improve your quality of life. Jane's story serves as a powerful reminder. Her headaches were more than just a sign of aging. They were a warning that led her to take action. After physical therapy and lifestyle adjustments, she regained her mobility and her mornings, proof that listening to your body can make all the difference. If you wake up with headaches that seem out of the ordinary, don't dismiss them. Pay attention to the patterns, seek medical advice, and take proactive steps to protect your health. Your mornings are the foundation of your day, and ensuring they are pain-free is not just about comfort. It's about safeguarding your future. The simple act of breathing, something we often take for granted, can become an unsettling struggle for some seniors upon waking. Morning wheezing or mucus production might seem like a minor inconvenience, but these symptoms often indicate underlying respiratory issues that warrant serious attention. For older adults, they could be linked to chronic obstructive pulmonary disease, COPD, asthma, or even early signs of respiratory cancers. Ignoring these signs can mean missing the opportunity to address potentially life-threatening conditions early on. When breathing becomes laboured in the morning, the body is signalling distress. COPD, a progressive lung disease commonly associated with a history of smoking or prolonged exposure to pollutants, is one of the primary culprits. The mornings are often the hardest for individuals with COPD because mucus accumulates in the airways during sleep, making breathing more challenging. Combined with wheezing, a high-pitched whistling sound when exhaling, this condition creates a daily hurdle that can quickly escalate if left untreated. Asthma, though often considered a condition that affects younger people, doesn't spare older adults. For some seniors, asthma symptoms like wheezing and excessive mucus can worsen with age. This is due in part to decreased lung elasticity and the cumulative impact of allergens, pollutants, or even undiagnosed infections. While asthma can usually be managed with medication, neglecting its symptoms in later life can lead to complications such as chronic bronchitis or pneumonia. However, the most alarming cause of morning respiratory distress is the potential link to lung cancer. Lung cancer often manifests subtly in its early stages, with symptoms like persistent wheezing, shortness of breath, and mucus production being some of the earliest indicators. Clara, a 70-year-old retired teacher from Texas, found herself waking up every day with a heavy chest and a persistent wheeze that she initially attributed to seasonal allergies. When the symptoms worsened and she began coughing up blood-tinged mucus, her family convinced her to seek medical advice. Tests revealed early-stage lung cancer, a diagnosis that, thanks to timely intervention, gave her a fighting chance at recovery. Understanding the causes behind these symptoms is crucial, but so is knowing how to respond. The first step is awareness. Pay attention to the duration and severity of your symptoms. Is the wheezing consistent, or does it come and go? Does mucus production increase during specific seasons or after exposure to irritants like smoke or strong odours? These patterns can provide valuable clues to your healthcare provider. A visit to the doctor is essential if these symptoms persist. Pulmonary function tests, chest X-rays, or CT scans can help identify whether the root cause is COPD, asthma, or something more serious like cancer. Blood tests may also be used to rule out infections that could exacerbate these symptoms. Early diagnosis not only improves treatment outcomes, but also enhances quality of life by addressing breathing difficulties head-on. While professional diagnosis and treatment are vital, there are actionable steps you can take at home to alleviate morning respiratory discomfort. One of the simplest yet most effective measures is hydration. Drinking warm water with lemon and honey upon waking can help loosen mucus and soothe irritated airways. The warmth relaxes the muscles in your respiratory tract, making it easier to expel mucus and breathe freely. Another valuable tool is the use of a humidifier, particularly in dry climates or during the winter months when indoor heating can dry out the air. Keeping the air moist helps prevent mucus from becoming thick and sticky, which can exacerbate wheezing and coughing. Additionally, regular steaming with essential oils like eucalyptus or peppermint can provide relief by opening up the airways and reducing inflammation. Lifestyle adjustments also play a critical role in managing these symptoms. Avoiding known irritants such as cigarette smoke, chemical fumes, or heavily polluted areas can significantly reduce morning respiratory issues. If you're a smoker, quitting is one of the most impactful decisions you can make to protect your lung health and overall well-being. Similarly, engaging in light physical activity, such as walking or stretching, can improve lung function over time by enhancing airflow and reducing stiffness in the chest. For Clara, making these changes was life-changing. Alongside her medical treatment, she began incorporating a morning routine that included gentle stretches, steaming, and avoiding exposure to household cleaners with strong fumes. Over time, her symptoms improved, and she felt more in control of her mornings. Breathing is not just a reflex. It's the lifeline to your health and vitality. If your mornings are clouded by wheezing or mucus, it's essential to act. Whether the cause is COPD, asthma, or something more serious, addressing these symptoms early can mean the difference between manageable conditions and irreversible damage. Listen to your body, take proactive steps, and seek medical guidance when needed. After all, every breath is precious, and ensuring it comes with ease is a gift worth protecting. For many seniors, food is more than sustenance. It's a source of joy, social connection, and comfort. However, When the simple pleasure of eating begins to fade, when meals lose their appeal or the appetite seems to vanish altogether, it's a change that warrants attention. While occasional disinterest in food can result from a poor night's sleep or a passing illness, a persistent loss of appetite can signal deeper issues, including the early stages of cancers, such as gastric or esophageal cancer. Loss of appetite is often an early, subtle symptom of serious health problems. The body, in its remarkable way, may start to flag a deeper issue through small changes that we sometimes overlook. For older adults, this warning can be even more critical. Gastric cancer, for example, often develops slowly, with appetite loss being one of its first and most persistent signs. When accompanied by symptoms like abdominal discomfort, nausea, or unintentional weight loss, it becomes an unmistakable red flag that should never be ignored. Esophageal cancer, another potential cause, presents similarly. This type of cancer can narrow the esophagus, making eating uncomfortable and leading to a gradual aversion to food. Frank, a 73-year-old retired carpenter from Oregon, found himself skipping meals because swallowing had become increasingly difficult. Initially, he attributed it to aging or occasional acid reflux. However, when the discomfort persisted and his appetite dwindled, he sought medical advice. Tests revealed early-stage esophageal cancer, a diagnosis that allowed for timely intervention and treatment. It's important to recognize that the loss of appetite is not just about food, it's about the body's ability to maintain its health and energy. When we stop eating adequately, our bodies are deprived of essential nutrients, which can lead to further complications, including weakened immunity and muscle loss. For older adults, this cycle can be particularly dangerous, as it can exacerbate frailty and increase the risk of falls, infections, and other health issues. If you or a loved one are experiencing a loss of appetite, the first step is to identify any additional symptoms. Do you feel bloated or nauseous after eating? Are there any changes in bowel habits, such as constipation or diarrhea? Are you unintentionally losing weight? These symptoms can provide valuable clues for your healthcare provider. Seeking medical advice early can help uncover whether the issue is related to digestive problems, hormonal imbalances, or something more serious like cancer. While medical evaluation is essential, there are also practical steps you can take at home to stimulate appetite and ensure adequate nutrition. Start by focusing on the quality of the food rather than the quantity. Light, nutrient-dense options like yogurt, fresh fruit, or nuts can be easier to manage and still provide the body with essential vitamins and minerals. Small, frequent meals can also make eating feel less overwhelming compared to large, heavy meals. Another effective approach is to incorporate foods with stimulating flavors. Spices like ginger, cinnamon, or mint can enhance the aroma and taste of meals, making them more appealing. For example, a warm bowl of oatmeal with a sprinkle of cinnamon and a drizzle of honey not only smells inviting but also provides gentle nourishment. Similarly, herbal teas like peppermint or chamomile can aid digestion and soothe the stomach, encouraging a more robust appetite. Staying hydrated is equally important. Sometimes dehydration can mimic or exacerbate a lack of appetite. Drinking water throughout the day or enjoying broths and soups can help maintain hydration while also delivering essential nutrients. For those who struggle with a complete meal, smoothies or shakes made with fruits, vegetables, and a protein source like yogurt can be an excellent alternative. In cases where loss of appetite persists despite these efforts, it's crucial to communicate openly with your doctor. Blood tests, imaging, or endoscopic procedures may be necessary to rule out or diagnose underlying conditions. timely intervention can lead to better outcomes, as Frank's story demonstrates. After his diagnosis, he underwent treatment that not only addressed the cancer, but also improved his quality of life. For seniors, the act of eating is about more than just staying alive. It's about thriving. Meals bring families together, offer moments of joy, and provide the fuel we need to live fully. When that connection to food begins to wane, it's important to listen to what your body is saying. Loss of appetite may seem harmless at first, but it is often the first step toward identifying and addressing serious health concerns. Don't let this silent warning go unnoticed. Pay attention to your appetite, nourish your body with care, and consult a healthcare provider when changes persist. Protecting your health begins with understanding the signals your body sends, and even something as simple as skipping meals could be a message worth heeding. Your future, your vitality, and your joy depend on it. Joint pain is often seen as a natural part of aging, an unwelcome but inevitable companion in later life. However, when that pain becomes persistent, particularly in the mornings, it may be more than just the wear and tear of time. For older adults, lingering joint discomfort can signal underlying health issues that go far beyond arthritis. In some cases, it might be an early indication of serious conditions like bone tuberculosis or metastasized cancer. Joint pain isn't always straightforward. As we age, the cartilage cushioning our joints thins, leading to stiffness and discomfort. This natural process is well documented and familiar. However, when the pain becomes severe, accompanied by swelling, redness, or limited movement, it's time to look deeper. Persistent joint pain, especially when it doesn't improve with rest or over-the-counter remedies, could indicate bone tuberculosis, a condition caused by tuberculosis bacteria infecting the bones and joints. While it's less common in the United States, this disease can have devastating effects if left untreated. Bone tuberculosis often begins subtly, with mild pain or stiffness that gradually worsens. A 68-year-old gardener named Richard noticed his knee growing increasingly stiff over several weeks, making it hard for him to kneel and work in his beloved garden. Initially, he dismissed the discomfort as arthritis, but when his joint began to swell and walking became painful, he sought medical attention. Tests confirmed bone tuberculosis, a diagnosis that required months of treatment, but ultimately saved his mobility and quality of life. Another serious condition linked to persistent joint pain is metastasized cancer, particularly when cancer from other parts of the body spreads to the bones. Breast, prostate, and lung cancers are among the types most likely to metastasize to the skeletal system. This type of bone pain is unique. It often feels deep and aching, worsening at night or during rest. Unfortunately, it's easy to overlook or misattribute such pain to common conditions like osteoporosis or arthritis, delaying crucial diagnoses. For seniors, distinguishing between benign joint pain and pain signaling a more serious condition can be challenging. However, there are warning signs that should never be ignored. Sudden and unexplained weight loss, persistent fatigue, or swelling and redness around the joint are red flags that warrant immediate medical attention. Imaging tests like X-rays, MRIs, or bone scans can help uncover the cause of persistent joint pain, allowing for early intervention and, in some cases, life-saving treatment. While professional diagnosis is vital, there are ways to manage joint pain at home and potentially alleviate symptoms while determining the underlying cause. Applying a warm compress to the affected area can help reduce stiffness and improve blood flow. Warmth soothes sore muscles and increases joint flexibility, offering temporary relief. For those who can tolerate it, gentle stretching or low-impact exercises like swimming or yoga can also strengthen the muscles around the joints, providing better support and reducing strain. Diet plays a significant role in joint health as well. Incorporating anti-inflammatory foods like fatty fish, berries, nuts, and leafy greens can help reduce inflammation that contributes to joint pain. On the other hand, processed foods high in sugar and saturated fats can exacerbate inflammation and should be avoided. Staying hydrated is equally important, as dehydration can reduce the lubrication in your joints, making them more prone to pain and stiffness. However, these home remedies should not replace medical evaluation, especially if the pain persists. Early intervention can mean the difference between managing a condition effectively and facing severe, irreversible complications. Richard's story is a prime example of this. By seeking help when he noticed his symptoms worsening, he not only treated the bone tuberculosis effectively, but also avoided long-term joint damage. In cases of metastasized cancer, early detection can save lives. Identifying cancer before it spreads further allows for targeted treatments that can slow progression and improve quality of life. Ignoring persistent joint pain as just a part of aging can lead to missed opportunities for timely intervention and treatment. It's also important to address the emotional toll that chronic joint pain can take. For many older adults, joint pain can limit mobility, reduce independence, and diminish overall quality of life. This often leads to feelings of isolation, frustration, and even depression. Seeking help, whether through a doctor, physical therapist, or support group, can provide the necessary resources to manage both the physical and emotional aspects of joint pain. Your joints are the framework that supports your body, carrying you through each day's movements and milestones. When they send signals of distress, it's essential to listen. Persistent pain is not a life sentence, but ignoring it can have serious consequences. Whether it's an infection like bone tuberculosis or a more severe issue like metastasized cancer, early diagnosis and treatment can restore comfort, mobility, and peace of mind. Don't let joint pain quietly steal your joy or independence. Take action, consult a healthcare provider, and explore treatment options. The road to relief starts with recognizing that persistent pain is not just aging, it's your body calling for attention. By addressing these signs early, you can safeguard your health, your freedom, and your future. Your health is your most valuable asset, especially as you age. The body has an incredible way of signaling when something isn't right, and mornings are often when those signals are the clearest. Whether it's persistent fatigue, morning headaches, breathing difficulties, loss of appetite, or joint pain that just won't go away, these signs are worth paying attention to. They could be warning you of underlying issues like chronic diseases, or, in some cases, the early stages of cancer. Acting on these signals early can make all the difference in preserving your health and extending your quality of life. We've explored how symptoms like fatigue might indicate thyroid issues or diabetes, while headaches could point to cerebrovascular problems or even brain tumors. We've also uncovered the hidden dangers of morning respiratory struggles, the silent warnings of appetite loss, and the overlooked seriousness of persistent joint pain. Each of these signs tells a story, your body's way of urging you to listen and take action. Ignoring them could mean delaying diagnoses that are key to effective treatment. Regular checkups are your first line of defense. They help detect conditions before they progress and offer you the chance to address them head-on. Proactive living, whether it's adopting a nutrient-rich diet, staying hydrated, engaging in gentle exercises, or simply being mindful of changes in your body, is equally essential. These small, everyday habits can have a profound impact on your overall health and well-being. But health isn't just about personal action, it's about spreading awareness. By sharing this information with family, friends, and loved ones, you're helping to build a community of informed individuals who can better care for themselves and others. Together, we can reduce the fear of the unknown and empower one another to act early and live healthier lives. If you found this video valuable, please subscribe to our channel and turn on notifications so you never miss important updates. Your engagement helps us continue to create content that could save lives. Share this video with someone you care about. It might be the wake-up call they need to take charge of their health. Your mornings set the tone for your day, and your health sets the foundation for your future. Stay informed, stay proactive, and above all, take care of yourself. Your health journey starts now.